Today I will be demoing the VOMS, the Vestibular Ocular Motor Screening Assessment. It is used as a brief 5 to 10 minute concussion screening tool designed for ages 9 through 40. Outside of that subject age range, interpretation may vary. This test can be used to help identify those who have been concussed versus non-concussed. Nearly 30% of concussed athletes report visual problems during the first week after injury, according to Physiopedia. Ocular motor impairments and symptoms may manifest as blurred vision, diplopia, impaired eye movements, difficulty in reading, dizziness, headaches, ocular pain, and poor visual-based concentration. Dizziness, which may represent an underlying impairment of the vestibular or oculomotor systems, is reported by 50% of concussed athletes and is associated with a 6.4 times greater risk relative to any other on-field symptom in predicting delayed recovery of greater than 21 days. The VOMS looks at 5 different domains: smooth pursuits, saccades, horizontal and vertical, convergence, VOR, vestibular ocular reflex, and visual motion sensitivity. A convergence of greater than 5 centimeters is abnormal. For the other test, rating the patient's symptoms after each test is imperative compared to their baseline, and a rate of more than 2 on a scale of 0 to 10 for headache, nausea, dizziness, or fogginess is considered abnormal. New VOMS literature recommends pre-season testing of the VOMS to establish a baseline. It also recommends a use of change score to determine whether or not symptoms are provoked by a specific activity. Prior to performing the 5 domains of the VOMS, it is imperative that we establish the patient's baseline symptoms. So you would ask the patient on a scale of 0 to 10 to rate their symptoms of headache, dizziness, nausea, or fogginess. That way you can compare them after each domain. Thank you.
Hi, Megan. I'm Danielle, your physical therapist today. We're going to be doing a vestibular ocular screen just to kind of see how your eye movements are and how your balance is, okay? So the first thing I want you to do is just follow the stick, okay? With your eyes, keep your head still, and just follow the stick with your eyes. And after doing that, do you have any symptoms such as headache, dizziness, fogginess, nausea? Okay, Megan, for the next test, I'm going to hold up a target, 2 different targets actually. You're going to switch your eyes from target to target 10 to 15 times while keeping your head still, okay? So the first one will be here. Do you have any symptoms of headache, nausea, fatigue, anything like that, fogginess, dizziness? Okay, Megan, for this next test, we're going to be testing convergence of your eyes. So you're going to hold the stick out like this and bring it towards your nose. And when you see 2 sticks, or you see any outward deviation, you're going to stop and hold it right there at that distance. And then I'm going to measure, okay? Does that make sense? And that's 3 centimeters, so you're within the normal, which is 6 centimeters. Do you have any symptoms, the headache, nausea, fogginess, or anything like that? Okay, Megan, for this next test, we're going to be testing the VOR, which is the vestibular ocular reflex. So I'm going to hold this target. You're going to be turning your head at 20 degrees on each side while maintaining focus on this target, okay? And I'm going to have a metronome to which you are going to move your head to the beat of. Does that make sense? You'll do 10 to 20 repetitions. Okay. Ready, and go. Okay, Megan, for this next test, we're going to be assessing your visual motion sensitivity. So you're going to interlace your fingers like this, keep both of your thumbs up. You're going to rotate 80 degrees to each side. That's 1 rep. 2, you're going to do that 5 times. I'm going to have the metronome set to 50 beats per minute, and you'll be doing it to that beat, okay? And I'm going to stand by to make sure that